14 million children in this country have a diagnosable psychiatric or developmental disorder. Of those, only 20% receive any treatment, and of those 20%, only 2% receive a treatment with any evidence of it working. At the Child Study Center, we are singularly focused on this problem, and we're doing many things to spread effective care everywhere. To accomplish this, our treatments must be developed to be accessible and affordable to the people who need them. We built large innovation networks of practitioners and scientists so that we can engage with a diverse group of people around the nation and most recently around the world.
Children are always changing. They're always growing, they're always learning, they're developing, they're evolving, they're responding. And so there's an opportunity to help them and to help shape their lives. Implementation science is research, is a scientific body of knowledge about how best to take effective practices and to have them be widely used, to have them get out into the everyday world. We don't have a one-size-fits-all. That would be very short-sighted. So we think that it's working in part because it's all a partnership model. The only way in which you can make these kinds of programs actually stick, be sustained, have an impact, is if you can adapt it for the agency context, for the staff, and if you can stick with them and help them out as they are trying to implement it.
Trauma is so important because it affects so much of a child's life. Children live within environments, and those environments are awfully important, and unless that's addressed, things are not going to improve. Trauma systems therapy is a set of interventions, social environmental interventions. What's going on around the child? Is there ongoing trauma? The second part of intervention is about helping the child regulate emotional states. One of the sites in this innovation network is KVC, an organization in Kansas.
KVC is a large multi-state child welfare and mental health agency. There was a small population of children for whom we were continuing to struggle. These are children who've often gone through a lot of trauma. I did a lot of research on various evidence-based practices, and we decided that trauma systems therapy was by far, hands down, the best fit for our child welfare system here in Kansas. Our working relationship with NYU has always been extremely strong. They see us as a collaborative partner, and we have seen marked improvement in a child's ability to function on a day-to-day basis. As children and their caregivers learn how to manage those emotions and those behaviors, kids settle down. They start to be able to have friends. They're able to do what's being asked of them at school. They're able to sit around the family dinner table and have a nice, enjoyable meal. It's remarkable what can happen.
When you look at juvenile justice populations, those kids are often even more traumatized than the kids in psych hospitals. So they're kids with a lot of traumatic exposure, and they had no strategy about how to deal with it. So we got an opportunity to apply for a grant to take our trauma technology that we developed on inpatient and actually move it into these 2 detention facilities. We changed the way they screened, which dramatically increased the recognition of PTSD and increased the number of kids that were actually getting referred to psychiatrists. It was a very effective strategy for helping the staff understand kids' behavior and for giving the kids some foundational skills themselves. The effort was really to build up the skill level of the main people who were doing most of the work, and that's been very successful.
We're focused here on providing the best care for children and families who come to us for care, but to do it in such a way that it can improve the lives of kids all over the nation or more. This is what spreading effective care everywhere is all about.